Hello everyone, this is Dr. Raja Krishnan. I'm an assistant professor working here in SNS College of Physiotherapy. This is the part 2 video of myasthenia gravis. We already shown that what is myasthenia gravis. It is a progressive failure of the muscle to contract. It loses its ability because of the causes in the neuromuscular junction. We already cleared about what is neuromuscular junction and what it is happening in the neuromuscular junction while the muscle contracts. And the acetylcholine receptors can't bind with the acetylcholine, so the neuromuscular junction is not working. In this incident, we saw for this incident. After this, the age group, I already said that, I already mentioned, it will be for both genders. Commonly, it will affect below 40 years for women, above 60 years for men. And after this, the etiology is unknown. Even though the etiology is unknown, it may be because of any underlying immunosuppressant disease, defect in the transmission of nerve impulses to the muscles, like that. The pathology, main pathology is the antibodies against ACH receptor impaired transmission of the impulses across the neural function, the availability of fewer receptors for stimulation, voluntary muscle weakness that escalates the continued activity of the muscle. After this, we are going to the classes or subdivisions of the myasthenia gravis, which is denoted by the, which is said by the American Society of Myasthenia Gravis. There are six. There are six types in the myasthenia gravis. One is the late onset of myasthenia gravis, early onset of myasthenia gravis, and there is the uh, myasthenia gravis associated with the musk antibodies. The myasthenia gravis, which is associated with the musk antibodies, is the main type, and there is the myasthenia gravis associated with the acetylcholine receptors inhibitors. And only six types in the myasthenia gravis. After this, they are divided into five subclasses, from class 1 to class 5. There are seven divisions in these five subclasses. It is under the divisions of by which it is affected, by which it is starting, where it is affecting the muscles, and how severely it is affecting the muscle. In the myasthenia gravis, we can clearly understand one thing: it is affecting from the ocular side, so that in the first slide you notice that ptosis word is there. If the ptosis is there, we can conclude that we can go for myasthenia gravis test. And after this, in the myasthenia gravis, it will start with the ocular muscles, and it will come to the bulbar, that is oropharyngeal muscles, and it comes to the neck, and it will come to the upper limb. First, it will affect the proximal muscles rather than the distal muscles. The proximal muscles are more affected in the myasthenia gravis. These are the subclasses which is affected. We can conclude the clinical features as the intermittent ptosis, or maybe it will go for diplopia. I already said, starting from the eyes, and it goes for the chewing, like bulbar and oropharyngeal muscles. The chewing weakness will be there, the swallowing difficulty will be there, the speech will get affected, the asphasia will be there, weakness of the jaw muscles. They can't able to open their jaw. Along with the uh, ptosis, uh, they can go with the dysphonia. They can't be able to speak. Their sounds won't get out. The weakness of the neck muscles will be there. After that, it will go for the aspiration. In this myasthenia gravis, there's another condition which is also called as myasthenia crisis. That is also called as myasthenia crisis. It is a very danger. It is very danger one, where the respiratory muscle will go for weakness. The patient can't be able to the patient can't be able to breathe himself. First one, we have to see the clinical features, and then we have to move for, and then we have to move for the next of the clinical features. The first one is the ptosis. We have to investigate the ptosis with the ice packs, and we can move for the jaw muscles opening. We will say the patients to open and chew like a solid particles and the soft particles, and we have to make the patients swallow. We will see in the next video what it is happening and how we have to investigate and how we will treat